Welcome, everyone. We're so pleased that you could join us for this year's October and Beyond webinar series. This is our 7th annual and going strong. For those of you I haven't met, my name is Kimberly O'Connell. I'm an occupational hygienist and dedicated my career to occupational disease and illness prevention. I'm so happy to be doing so now with OCAL. I don't know about you, but this has been a very busy October, it seems, for the world of occupational health and safety. First with the World Congress hot on the heels, and then the OHAL Fall Symposium for those hygienists in the crowd, and then just this week with EPICO. So for those reasons, and to give space for Global Ergonomics Month, we decided to shift October to kick it off today, and then into November, also recognizing Lung Month. So today is about framing the future of occupational disease and illness prevention, and the importance of doing so driven with data and evidence. We all recognize a major problem with occupational illness prevention is its under recognition and under reporting. And so without further ado, I am very happy to have some welcoming words from Dr. Joel Moody. Joel is our newly appointed Chief Prevention Officer and Assistant Deputy Minister for the Ministry of Labor, Training and Skills Development, just recently on September 15th. So he joins the ministry from the Electrical Safety Authority, where he held the role of Chief Public Safety Officer and Senior Director Analytics. He's a seasoned public health and occupational health and safety leader with over 17 years experience working in various labor organizations throughout the province of Ontario. As a member of ESA's senior leadership team, Joel led its future strategic direction to achieve getting to zero vision of safety in Ontario. He led numerous high-profile projects, which included developing strategies and tactics to combat electrical fires in high-rise occupancy residential structures, impacting over 6,000 dwellings in Toronto, resulting in City Council changes to bylaws requiring multi-residential electrical maintenance plan. He's championed innovative approaches to harm reduction and regulatory oversight, and made equity, diversity, and inclusion central to his philosophy of leadership. Furthermore, his ability to build and maintain strong relationships with stakeholders, as well as his passion for worker health and safety, is well known throughout the health and safety sector. Joel has an executive education certification in strategic management of regulator and enforcement agencies program from Harvard. He has a Doctor of Medicine, an MD, an advanced certificate in epidemiology and biostatistics from George Washington University, a Master of Public Health, International Health Epidemiology from the University of Alabama at Birmingham, and a Bachelor of Science in Engineering, Civil Environmental from Duke University. So please welcome Dr. Joel Moody.
Well, Kimberly, thank you so much for that introduction, and want to say good afternoon to everyone. It's really my honor to welcome you to OCAL's 7th annual October conference, The Path Forward. As Kimberly said, my name is Dr. Joel Moody, and I'm the newly appointed Chief Prevention Officer in the Prevention Division at the Ministry of Labor, Skills, Training and Skills Development here in Ontario. As Kimberly said, I joined the ministry from the ESA, or the Electrical Safety Authority, and I had the role of the Chief Public Safety Officer, as well as the Senior Director of Analytics. With my background in public health and epidemiology, I'm very passionate about occupational health and safety, and also illness and injury prevention. So I'm looking forward to working with all of you in the years to come. I've only been on the job for about 6 weeks now, but I've had the opportunity and the pleasure to talk with many of our health and safety partners, really to learn about what they're doing to help promote a healthy and safe workplace in Ontario. But more importantly, really, what can I do as the CPO and the ministry to support you all in those efforts? Before I start, I do want to take a moment to read a treaty and land acknowledgement, which is inspired by the recommendations of the Truth and Reconciliation Commission of Canada. I will read this acknowledgement for Toronto, since that's where I am now. Traditionally, Toronto has been a gathering place for many nations, including the Anishinaabe, the Haudenosaunee, as well as the Wendat people. I acknowledge we are meeting in the area covered by Treaty 13, also known as the Toronto Purchase, and I pay my respects to the Mississaugas of the Credit. I would like to also acknowledge the Indigenous people of all the lands that we are on today. While we meet today in a virtual platform, I would like to take a moment to recognize the importance of the land, which we all call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their culture. From coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we are and can each in our own way try to move forward in a spirit of reconciliation and collaboration. Over the last year and a half, we've all been faced with some unprecedented challenges, and accordingly, we've had to adjust, be agile. So we're still in this COVID pandemic. Now it's fourth wave, and we cannot continue to be as vigilant as ever. In such challenging times, it can really be difficult to try to find those positives. However, I think we can all agree one positive that I would like to highlight is really that heightened focus on awareness of the importance of occupational health and injury prevention. I take over from my predecessor, Ron Koleski, at a very exciting time for the ministry. As you may know, the ministry has launched its Prevention Works strategy, which is the name of our occupational health and safety strategy for 2021 to 2026. Prevention Works is a framework to help ensure that Ontarians and Ontario remain one of the safest and healthiest places to work in Canada. The prevention of occupational illness is an area of system focus within the Prevention Works strategy. We know that Ontario workers continue to be exposed to occupational hazards at levels that cause illness, and I know we can do better. Work-related illness result in over 75% of those workplace fatalities. They have a negative impact on the quality of life of the worker and their family. And the cost, aside from that quality, billions of dollars per year. When we talk about healthcare expenditures, lost productivity. For example, between 2010 and 2019, the WSIB allowed about 136,000 occupational disease claims, which made up over $910 million of costs. As we know from the research, these statistics greatly underestimate the prevalence of the burden of occupational illness, which is largely due to the under-recognition and definitely under-reporting. So we've been working with our occupational health and safety system partners to develop a new occupational wellness prevention plan for Prevention Works, such that we can improve the recognition of occupational illness and the control of these exposures in the workplace that can lead to occupational illness. I want to take a little time to acknowledge the Occupational Health and Safety Clinics for Ontario workers for their leadership in the implementation of the system's Occupational Disease Action Plan, and particularly Kimberly O'Connell, who is playing the lead role in the development of this plan in partnership with the ministry, other speakers at this conference, and also Dr. Paul Demers. The themes of this conference: framing the future, examining change, one of my personal ones, research and data, workplace tools and knowledge mobilization, and continued collaboration really provide a roadmap for future success and focus for our prevention efforts. So by working together, we can better protect Ontario workers from occupational illness to help reduce the burden on communities, workers, and their families. But before I finish, I just wanted to acknowledge the work that you all have been doing to help keep the workers safe during this COVID pandemic. You all play a key role in supporting a strong, healthy, resilient, and productive workforce that drives our economy. By being here today, you are helping to make Ontario one of the safest places to work, and I look forward to working with all of you and continuing this conversation well into the future. Thank you very much. Kimberly?
Thank you, Joel. That was wonderful words of welcome. We so look forward to working with you, and your dedication is evident right out of the gate. So really appreciate your being here. It does a lot to our efforts on illness prevention. So I hope you can stay with us or join us as the series continues, but I know you're a busy guy with lots to do. So we'll be here as you can and as you stay, and I will go ahead and introduce our next speaker, if you will. Cheers.